those who are joining us today for this live session. It is a very unique, you can say, one of its kind live session today that we have organized for all the students who have appeared for their NEET exam this year and who are looking for admissions into MBBS. It's a lucky day for us, for Rus Education, for you students, and for the land of India that we have the handsome, charismatic Dean for International Students of Orenburg State Medical University, Professor Anton Olegovich Mironchev. Welcome to India, Anton Olegovich.
Thank you, Dinesh. So energetic introducing of me. Hey, dear students and their parents, I'm glad to be here. I'm glad to participate in this educational fair week, and I think that we will get good results of this work, and you will get results which you want and which you wait from this fair week.
So, dear students, see, Orenburg State Medical University has been the top choice for Indian students studying their MBBS. And yes, the high level delegation from Orenburg State Medical University is now present in India just for you all guys to guide you in a proper way. So, Anton Olegovich, what is your plan for this visit? Which cities are you visiting, and like students can meet you in which places on which dates?
Okay. Our delegation, not only me, came to India. Tomorrow you can meet delegates in Trivandrum. At 27 you can meet me in Mumbai.
Mumbai, 27th and 28th.
28, 29 in Calcutta, and 31st in Delhi. This will be final fair that will be in Delhi.
In Delhi, yes. So, dear students, are organizing Russian Education Fair jointly with Russian House in India. So, you can meet the delegates of Orenburg State Medical University tomorrow. It is 26th in Trivandrum in Russian House. On 28th, you can meet our guests from Orenburg State Medical University in Russian Education Fair in Russian House in Mumbai. 29th, they will be present in Kolkata again in Gorki Sadan in Russian House in Kolkata. 31st will be the last day of Russian Education Fair where you can come and meet the delegates in New Delhi. 31st in Russian House, which is near Mandi House. So, Anton Olegovich, like what all things you have planned to tell our students in these Russian education fairs?
First of all, I'm representative not only of university, but I'm representative of my country, of Russian Federation, and I want to tell that we are not only one university which are very good in education for medical profession. We have many universities, and first of all you need to choose. How to choose? This is a reason of making speak, because you need to meet representatives of universities, you need to get direct information from them, you need to understand together with your parents what is good in this university, what is good in this university. Like in your country, we have many different regions. In one region, this climate, in another region, this climate. Maybe you wait these living conditions, maybe you wait another living conditions, maybe you wait participation in sport mostly, and so on. You need to find what is better for you, in which university. Maybe you wait full medium of instruction in English, maybe you don't need this, you don't wait this, maybe you want to study on Russian language.
No, but Anton Olegovich, I would like to interfere here. As per the new rules of Indian government, you have to take admission into only that university,
yes,
which gives complete education in 6 years. So here is one major question that students have, that is Orenburg State University providing the complete course in English language?
Orenburg State Medical University really provide full course of education, 6 years, one more time, 6 years, this is another NMC rule,
Yes.
only 6 years of education, fully on English medium.
Okay.
Because we made special English for our teachers. This course is already 3 years is going on. More than 200 teachers already went through these courses. Not only those teachers who work with my students from India, but another teachers too of university. That's one more time, of teachers of our university is English speakers.
So students,
That's
yes.
why we can.
Yeah, so again, a major question that you all have, that you want, or it is also the factor while selecting a university, that the university should provide complete 6 years in English medium. And yes, Orenburg State Medical University is one of those best medical universities of Russia, which provides complete curriculum of 6 years in English language. And yes, the teachers who will be teaching, they themselves are being taught English language. Yes, they are taking courses.
To tell, it goes to program of education in India.
Okay.
This is main thing. Another thing, in this curriculum at upper courses 5th and 6th, you will get mostly clinical subjects without anything else. Program of education, for example, by therapy on 6th year, this is program like in residentship you will get. This is syndromatic preparation, education by different diseases. At 6th education, this is syndrome preparation. Another thing, this is a question of clinical preparation. See regulation 2. At 6th year, you will get this like internship program. This is very needful. New curriculum already has it of education. That's why this is another great thing. Next, scientific society. Our scientific society works not only with Russian students, it works with foreign students too. And we made special route of scientific society on English clinical medicine, where our students participate. By only one session, I can't tell everything, but on a fair week, I think everyone will get full information when they will come. But main rule of our education, this is quality. I think this is mostly good answer for your question, because quality, this is top what we wait.
Yes.
We wait teachers from ourselves, and of course we wait this from students. And everyone who will choose Orenburg State Medical University need to understand that we will wait from him or from her very good quality of education.
Okay, so students, yes, see, as per the new NMC regulations, your course curriculum should have 1 year of internship. Nowhere else you will get it as a part of the curriculum of that particular state or that particular country. But in Russia, and especially in Orenburg State Medical University, the program is devised as such that in 6th year of education, it will be completely clinical, or you can say almost residentship or the internship program, and it is recognized in India. So once you come back after your completion of degree from Orenburg State Medical University, you will be able to practice because it comes under the new NMC regulation of 2021. Most important thing is that what the university dean has informed you, that university is committed to give you quality education. This is the same requirement that they have from their teachers. The university has it in its core value to provide quality education, and they will help the students to get that quality education. Apart from that, the biggest question of our Indian students is that they come back and they sit for this FMGE, the Foreign Medical Graduate Examination. So how the university help the students clear this examination?
First of all, each student in the question of FMG need to understand that his motivation, this is his motivation. We try to make our motivation, and yes, this works. But if you want to be a good doctor, and this is your future profession, this is your choosing of your future life, motivation must be yours. You really need to understand why you want to be a doctor, what you're waiting after 6 years of graduation from our university. If you understood this from the starting, you will pass FMG. If you not understood, if somebody kicking you to be a doctor, maybe you will be, maybe you will understand that this is good for you, but you need time for this.
Yes.
You need time. That's why it's better to understand it early as you can. This is first thing. Second thing, what university, together with Rus Education, we make sessions of teachers from India who prepare students not only, for example, in our university, but prepare in India too. And this is good. We know that program of FMG divided into different subjects. We know what subjects is main. That and you must understand this too. That near 60% of questions in FMG will be by 6 main disciplines. Six main. 20% other will be through other 9 disciplines, and only 20% for other near. How many it will be? Other 7 disciplines who are in the program of FMG. That's why you need to make focus on these subjects, and we will give this understanding for the student too. Next, in the program of education of our disciplines, of our departments, we put a point to preparation for FMG. We got these questions. We understood that structure. We understood main things which asked from the student on FMG, and we try to make focus during program of education on our departments. Preparation for government examination. On government examination, our students have one of the part of examination. This is testimonial tests, and this test prepared same as FMG program. This is simple question, positive answer, and part of these questions they like in FMG. That's why this is preparation and so on. Many different things we performed for better education of student for FMG result, good FMG result.
So students, yes, you can understand that the university is committed towards making you not only doctors, but helping you qualify FMGE so that you can get a license and you can practice as a doctor. And how it's beneficial to have such a motivated dean who is committed enough that during his previous visits he took the question. He has incorporated the study material of FMGE into the various departments, and now your various departments, they come on FMG module. So the teachers now understand what type of questions are asked in FMG, and accordingly they plan their study pattern. Moreover, university has been kind enough to allow us together to conduct classes for preparation of foreign medical graduates. So in the university brochures that we provide, we have shown you the classes that take place for FMG preparation inside the university campus, which will help in clearing this FMG. So what happens is the teachers from top universities of India or from bigger hospitals, they visit Russian universities and they conduct classes for FMGE which are important to understand the exam pattern and to clear the syllabus of FMGE while you are studying your MBBS. So these are the steps that have been taken by the university. And Anton Olegovich, do you see the result of these effects in the final FMG passing ratio?
Of course I saw. Everyone saw these results, and I think that each university need to make focus on this, because not only diploma, this is goal of student. Goal of student is to pass through accreditation. As you remember, years ago, near 3 years ago, one of the top result was 14-15%
Yes.
of past students who graduate from university this year. Small is it or big? I think it's small. And we understood this from starting, that this is not our way, we want more. And we tried. Our first students who graduate, who tried to pass through FMG, they showed more than 30. And right now I can tell you each year our students passed FMG from the starting, more than 30% of graduates who tried to pass. Next, I can tell you that our first graduation was 4 years ago. 4 years ago. It means that students already got permission to pass FMG 5 or 6 times.
Yes.
Who want? Who want? Right now, from these students, already near 80% students passed FMG. And I can tell that even in population of Russian students, not everyone will be a doctor after the graduation. Something can change in life, some understanding, student, some another way of living and so on. And this is near how many? This is near 10%. That's why I imagine 10% their decision. Yes, and only 10% not passed.
Not passed.
This is, I think, very good result. That's why we together, students and their parents, need to make focus on FMG preparation, because this is only one way to get accreditation and to work here as a doctor.
Yes. So yes, so students, when you come for your counseling sessions, or when we meet the parents in our seminars, so the major question is that the result of FMGE is very less. Only 10, 12% or 15% students pass FMGE. But you see, because of the efforts which have been put into by the university administration of Orenburg State Medical University, the pass percentage of our graduates in this university is more than 30%. Some shown the result of 40-45% also, yes. And the average, you can say, is 30% in first attempt. So these are the results that these small efforts can make, can show. And yes, this is the commitment that the university has towards education of Indian students. So Anton Olegevich, apart from that, there is a major question about practical knowledge. People have this misconception that Russian universities provide only theory. They do not have practical.
This is not true. Even these words I can tell. No, because Russian Federation, this is, I think, one of the countries which really can give permission to students to work with patient. In many other foreign countries, you will work only with resin 1. That's all. In simulation center, only your preparation, clinical preparation will be. In our university, in different Russian universities, you can prepare not only simulation center, but in clinics too. And all clinical subjects, mostly they go in clinics. Only one thing, if student want, he will go to patient. If he want, he will find the way how to work with this patient. You need to understand. You will come to Russian Federation, and if you wait that all patients will speak with you in English, this is not true. They will not. They will speak on Russian. That's why we prepare students for Russian language, because this is preparation of medicine, of clinical profession. Without patients, it's impossible.
Yes.
You need to work with patient, and you will, if you want. If you don't want, you will stay behind other students. First line will work with patient, other will stay and dream about something. This is one more time, in arms of student. Second thing, this is industrial practice. You know that right now many students stayed in Russian Federation. All of them right now have industrial practice in our clinics. This is real, yes, you will get. If you want, if it's possible, you can come back home and make practice in clinics with whom we have contracts. But really I know situation right now, because really clinics not provide such practice, and they try to move students to
Simulation center.
simulation center. And at 5th year, for example, right now it's very interesting to students. As we go, we not permit to 5th year students to come back home. Only practice in Orenburg, because this is ambulance practice and practice in admission department of clinics. This is very needful. This is great experience for students. Right now, students work at this practice very good together with doctors,
Yes.
with experienced doctors. No problems.
So yes, see, when it comes to practical exposure or practical training, Russia is the countries where students are allowed to work on patients. Your clinical subjects are being taught in hospitals at the patient's bed. So you get enough practical. Antonovich, one basic question: do you get dead bodies for preparation of anatomy, clinical anatomy, or on only the posters or books?
Yes, we have real biological material. With these words.
Okay.
Trying to tell, it's better. And our students work with this biological material, even plastinates. And you know that mostly this is 3 countries around the world who make plastinates. And one of the countries, this is Russian Federation in St. Petersburg, they make plastic, and we have in Orenburg these plastinates. We bought them specially for students, and not even biological material from formalin, with whom they can work, but even with plastinates, upper body, lower body, limbs, and extremities, and so on.
Okay, so see, for your practical knowledge, your practical exposure, everything is available that you require to get practical knowledge. And yes, apart from simulation center, which you undergo training in 2nd year or in 1st year, then after 3rd year you start going to hospitals and you work with patients during your study of clinical subjects.
Another thing I can tell, and this is very interesting, in every university, in small amount in Russian Federation, Orenburg one of them, we saved operations on animals. On 3rd year, you will have subject topographic anatomy, clinical anatomy, operative surgery, where you will have minimally 5 days of operation during whole year, and it will be on animals. This is small animals, rabbits or dogs. Teacher will help to prepare this operation. It will be different surgical teams. You will have your role in the surgical team, and you will make this operation, of course, directly after speaking with teacher on the topic of this operation. He will examine students, they know, they don't know, and after this he will give roles. And best student will be first surgeon. Someone will be second, someone will be third, someone will be anesthesiologist, someone will be medical sister or brother, and so on. And this will be operations like tracheostomy, conicostomy around the world. You will make this on real animal who are alive, and this animal alive after your operation
also.
Of course.
So see, this is the amount of practical knowledge that you get, and in 3rd year, during your subject of topographical anatomy, you will be subjected to conduct operation on live animals, and as per your knowledge of the subject, you will be assigned roles. Some of the students will be a head surgeon, somebody will be assistant surgeon, somebody will be a nurse, somebody an anesthesiologist. So accordingly you will be assigned roles and conduct operations on live animals also. So for practical knowledge, there is ample amount of opportunities that Orenburg State Medical University. Antonin, which you just told that students need to learn Russian language, and how much it is important for students to learn Russian language, number one, and how the university helps them to study Russian language. Do you think it is it should be a principal part of the subject of the students because they in English language? So how much Russian they should understand and what Russian is being taught to them?
Good question. Good question. But first of all, Russian language is very needful because this is foreign. First of all, if you go, I don't know, somewhere in China, you will study, for example, an English medium, but you will learn Chinese too. Why? One thing I already told, this is patients with whom you will work. It's good if patient English speaks. Okay, this is one situation. Another situation, if this is native citizen who don't speak English, what you will do? You need to know native language of this country. This is first thing. Second thing, this is question of adaptation. Foreign country without foreign language, mostly this is impossible. Yes, sometimes in different countries, English, this is helper.
Second language.
Second language, yes. But about Russian Federation, language is Russian language. Yes, that's why even in questions of the adaptation, student will go to shop, student will go to cinema, and so on, to restaurant. He need to know Russian too. That's why at first year of education, where mostly this is paramedical subjects, like telling like this. This is paramedical year. Medical subjects they have. This is nursing. This is very needful, and this is very big block. They will have anatomy, histology, and so on. But paramedical subjects they will have too. And one of them will be Russian language. You will spend this year, you will get maximal hours of Russian language at first year. And I can tell you that it's amazing how it's going on, because at 1 year I came for department and 2 weeks classes. You know, at 1st of November, classes starting. Yes, this is rule. At middle of November I came to department. What I saw? New student standing near the desk, teacher standing near the student. He read the text on Russian, telling him, and he write on the desk words by Russian. You understand?
Yes.
The teacher told to him. That's why it's very hard if you will study. Russian language not very hard. They can speak on Russian language very good. They don't try. They don't try to show that they know Russian language very good, because it's better for them to make it touch it in secret. But they speak Russian very well. And last and principal thing, this is government examination. As I told, that part of government examination, this is tests. Till now we got permission to make tests on English language, because this is test, and I think this is good to get test on English language. But another part, this is center. This is fully on Russian language, because this is government examination, and it must be with use native language of our country.
Yes.
That's why you need to prepare even for this. That's why adaptation and living in country, clinical work, and passing of exam. This is minimal 3 things why Indian students need to know Russian language and Russian Federation.
Okay, so it is like basically just like if suppose somebody from Delhi to Tamil Nadu to study medical, and if you have to talk to the local patients, old and who do not speak English, so it will be better for you to speak in the local language, right? So similarly, when you are going to suppose you say to Russia, and you are going for clinical subjects which you have to where you have to talk to the patients and you have to take the case history, it is always recommendable to speak to them in Russian language, because not all the patients they speak English. Very few speak English, but not all. So it is better. But yes, university will provide you with class language. Russian language will be taught to you as an additional subject. Okay. So Antonio Legovich, we have talked about the education. Students have to live for 6 years in your university, in your city. What are the facilities that the university provides, living conditions of the students during their study of MBBS in Russia?
Another we make focus. At starting, I will tell that we not provide to living on flats. We got some experience in this question, and we understood that this is not good for students because control in education is less if they live on flats. What we have two 9-floor buildings where our students live, and this is like small India in each building. In one building, this is in our big university campus, it's in the center of the city. There lives upper courses, students of upper courses. In another building, 9th floor, which was getted by university with helping of Rus education, we work together on the question of this building. Lives who will be admitted, this is first course. Second course, and students who choose this building because of conditions which they like more, for example.
So there are two hostels, right?
Two big hostels. This hostels for youngers, it's situated in the mall of our city. How many meters? This is near 50 meters between hostel and this mall.
Yeah. On the opposite sides of the roads.
Yes. There are many food courts, many shops which represented worldwide, and so on. Very good conditions for student. I think you will tell yes, because at the moment of coming to foreign country, this is a big question: where I will get food, where I will get, from where I will get medicines, and so on. Everything is near. And another very good thing that 500 meters hostel, we have another campus of university. At second floor, situated departments of first, second year for our students. That's why by the foot they can come to this campus, get classes, and come back to the place where they live. And after this, at evening, who want to study, he will study. Who don't want to study, he will go to mall.
Okay. So students for living, Orenburg State Medical University has two big student hostels. One building is inside the campus, again 9th floor building, and one building is near the biggest mall of Orenburg city. In that particular hostel, we provide accommodation for first year, second year students, because it is first of all near to the mall. So there are many food courts available. There are shopping, like for your shopping of clothes and for other entertainment purposes, you have everything in that mall. So it is easier for you to accommodate, acclimatize when you come to a foreign country. Moreover, there is one university campus which is located just near this hostel, which has departments for first year and second year students. In the university hostel, which is inside the campus of the university, the senior year students live. Apart from that, Anton Olegovich, suppose for Indian students or for Indian parents, it is very important what my student will eat. So any special arrangements for Indian food that your university has?
Yes, of course. On Indian mess we worked for many years, and right now we have mess. This is in campus where youngest lives, because at the moment of coming, not everyone wants to cook by himself. That's why here at this 9th floor hostel, we have Indian at 9th floor where Indian cookers, by the working visa, they make food for the students. And mostly students like this food. It's spicy, not spicy, depending on what student want. But minimally 3 times at the day, he will get food from this food court, Indian food court at 9th floor. And lunch.
Okay, so students, there is an Indian mess available. So, or maybe I should be talking to the parents now. So dear parents, don't worry. When your students, they go to study MBBS in Russia, in Orenburg State Medical University, there is a facility of Indian mess which is available in the university hostel on the 9th floor, where students can get food which is cooked by Indian cooks.
And in our malls we have basmati, we have spices including curry and so on. We have chicken, of course.
Okay, so everything is available. If
Everything
students,
is available. If students want to cook by himself, he will find everything.
everything that they
Everything,
require.
yes.
Okay. Yes, but you will not find your mother's love. Yes, that you will miss. But you will get Indian food when you are staying in Orenburg State Medical University. Apart from that, Anton Olegovich, any other activities that you plan so students don't feel away from home, like cultural festivals or Indian festivals or sports activities?
Of course.
A bit about that.
Of course. At first year, this is very big adaptation program. Together with Russian language department, to each group we gave a tutor, and this is teacher. This is not student of upper courses of Russian groups. No, this is teacher who will work with them on Russian language education, and from coming, she guides them to different museums,
Okay,
to
so
different places of the city. We show university, we show the city. Even sometimes we show on the bus travels some places in our region that is interesting to the students. This is one point of adaptation. This is cultural festivals, but I will tell truly that during COVID we not performed cultural festivals 2 years.
Yes.
We performed part of cultural festival at the graduation ceremony.
Okay.
At the graduation ceremony, at the believe everyone who saw our graduation, they understood that it was like small concert.
Concert, yes.
Where we showed what our students can. Next thing, this is sport. And during many years, I think you saw this, we came to this result that really students of my faculty, they are part of sport life of our university.
Yes.
For example, this year, this is first time in history of faculty, our students, our cricket team won in Ufa a tournament by cricket.
The inter-university.
Inter-university through all Russia universities, we got first place.
Okay.
Our cricket. We have our league, and each year we performed cricket in our university. But at this year it was in inter-university level.
Okay.
Inter-university level. Football, basketball, tennis, badminton, chess, everything that they want, they can.
Okay.
But of course they need to show that he is a real sportsman
Yes.
to be a part of official command of university, official team.
Team.
But all the sport types which I told, our students was part of official team.
Official team.
Yes.
So yes, see, not only is required to make you a complete doctor, but there are some co-curricular activities which include your sports activities, cultural festivals, and even small excursions and trips. So the university provides this whole adaptation program in the first year, where all the students, they are taken to various museums, they are shown the city, they are even taken outside the city to show various places in the state of Orenburg. So yes, you get to see the city, you get to get acclimatized to that particular place where you will be staying for 6 months. Apart from that, you can participate in the university sports championships and even inter-university championship. See, cricket is not being played in Russia, but yes, the university takes initiatives to help Indian students take part in cricket tournaments. This year, Orenburg State Medical University won first prize in inter-university cricket tournament, which was organized on whole Russia level. So yes, apart from good education, you get good facilities for accommodation and good co-curricular activities which help you make a big successful doctor. So Anton Olegovich, once again, a message to all the students who have appeared for NEET this and who are looking for options to take admission in MBBS. How would you invite them to your university, or what would you suggest them? How should they make the decision?
first decision you need to understand you really want to be a doctor or no. If you want, or maybe your parents want, because this is near 30% of students, this is decision of parents
Yes.
or other relatives. And I don't think that this is bad, because you need to listen what your parents want from you. If you made this decision, you need to work hard. You need to choose place. This place must be good. I'm telling not only about Orenburg State Medical University, because this is not true. Other good universities we have, but really Orenburg State Medical University, one of them. I graduated from this university. I got red diploma with highest result, 5.0. It means that all exams was excellent. And you can get same result. I can tell you that each year we have students who got red diploma on my faculty.
Indian students.
Indian students. It means that these students through all 6 years of education got excellent results on exams. Some percentage of good they can get, but mostly it means if they can, you can
You
too.
can do.
Even another thing, that we have 3 students who got prize as best student of the region. And
The
this
whole
is
region.
of the whole region, and this is Indian students.
Oh God.
It was before COVID, yes, before COVID. But 3 students, this is best students of region, and this is Indian students. That's why, if you want, we wait you in our university. University will try to make it best. I believe you understood, and you will see this on educational fairs days. But we wait from you hard work through these 6 years of education. Together we can make this.
So students, if you really want to become a doctor, the only thing required from your side is that strong will to become a doctor. So if you have that will, that conviction that you want to become a doctor, contact us to get admission in one of the best universities of Russia for Indian students, Orenburg State Medical University. To get direct guidance from the university representatives, we have organized this Russian education fair where you can come and meet the representatives of the university and get your questions or doubts cleared, and you can get direct admission in Orenburg State Medical University. So if you belong to Kerala, tomorrow we have Russian education fair in Kerala, that is 26th of July in Kerala, in Trivandrum, Russian House. If you are from Maharashtra, you can visit Russian education fair in Mumbai on 28th of July. If you belong to West Bengal, you can come to Russian education fair in Russian House in Kolkata on 29th of July. And if you belong to North India, New Delhi on 31st of July in Russian House for this Russian education fair. Come, meet the delegates, meet the representatives of the universities, clear your doubts, and start your journey towards becoming a successful doctor with Orenburg State Medical University. Anton Olegovich, thank you so much for joining us for this live session. And once again, from the team of Rus Education and all the students of India, I welcome you to India for this, guiding all the students, the prospective students, and clearing their doubts and getting them admission into your university. Thank you so much for your efforts.
Thank you. And right now, our graduates, Rao Abhishek wrote to me welcome words to India. Abhishek, hello. Thank you.
Abhishek, you are in Mumbai. You are from Mumbai. You can meet Anton Olegovich in Mumbai on 28th of July in Russian House, which is situated near Pedder Road. Okay. Thank you so much, Anton Olegovich, and thank you, dear students, for taking your time and joining this live session. If you have any doubts, any questions, you can call us on our student helpline number, which is 1-800-833-3338, and you can get in touch with our experienced counselors and clear your doubts. If you want to meet university representatives, you are most welcome to visit Russian Education Fair, which is being conducted in Trivandrum, Mumbai, Kolkata, and New Delhi. And you can confirm your admission. You can also visit our website www.ruseducation.in. Please subscribe to our YouTube channel. Don't forget to press the bell icon so that you get notifications of our future live sessions. Best of luck for your NEET results, and I hope that you already know what approximate marks you are going to score. So don't wait for your results. You can get admission right now, and don't worry about your career, your future. Rus Education is there to help you out. Thank you so much. Have a great evening ahead.